of my assessment for nursing 641. So Whitney, as we did earlier, I did an assessment more focused on your head. This one's going to focus more on the rest of your body. There's still going to be some with your head checking for notes and stuff. Is that going to be okay?
Mm-hmm.
Okay. First thing is I'm going to double check your sinuses again.
Okay.
So I'm going to do frontal and then maxillary. Any pain or discomfort with that?
No.
Okay, so there's no tenderness noted on the palpation of the sinuses. Next, I'm going to start checking lymph nodes.
Okay.
So there's going to be quite a few areas for lymph nodes to check, just to warn you. So I'm just going to be saying them out loud as I go through, okay? So the first one is there's preauricular, and then there's postauricular, there's occipital, there's tonsillar, then there's submandibular, and then submental. Any discomfort or pain anywhere with any of those? Okay, now I'm going to work down your neck on these two, okay? So then there's the superficial cervicular, there's the posterior cervicular, and I'm just going to go a little bit deeper here, and then the supraclavicular. Any pain or any tenderness with palpation on those?
Mm-hmm.
Okay, next I need to do some both in your arms and in your chest, okay?
Okay.
So I'm just going to have you stay kind of relaxed. You're going to feel me. I'm actually going to have to go up into your armpit for this one. So I try not to tickle. I apologize. I know my hands are cold. So,
Okay.
All right, so just nice and relaxed. So I'm just going to go up high and deep to the central. And then for lateral, you're just going to kind of feel around your arm. Let's see if there's any pain or discomfort.
Nope.
Okay, I'm going to go ahead and do the other arm and then I'll move to your chest. So same thing, just kind of relaxed, up deep and high to the central. And then lateral, I'm just going to kind of feel all around the arm, make certain there's nothing hiding anywhere. Any pain or tenderness with palpation on those?
No.
Okay. And then the midclavicular. And then kind of pectoral, which is across the pec muscle. Any pain, discomfort at all? No. Okay, so right now it looks like all of your lymph nodes are good. All right, and so now I'm just going to kind of look and assess your arms. So it looks like your skin tone's even, your temperature's warm. Okay, I'm going to check your radial pulses, so relax over for me, perfect. I'm going to do this at the same time. As I'm feeling them, I can tell that they're steady and even, and they feel to be a 2+, which is completely normal, so it feels like those are okay. I'm going to hop up to your brachial. So those also feel like they're a 2+, normal, even, right? So overall, your skin assessment is that her skin tone is normal and even. It's warm to the touch. I don't notice any rashes or lesions at all. Both radial and brachial pulses check out to be a 2+, equal and even. No irregularities or anything like that noted anywhere. And now let me check your cap refill real quick. So just a little bit of pressure. And then cap refill is also less than 2 for a refill, which is completely normal. And now I'm going to be listening to your heart. So I'm going to listen to it 2 separate times with both sides of my stethoscope just to let you know. And there's multiple areas that I'm going to be listening to. Okay. So I'm going to start over here. So this is your aortic. And straight across for pulmonic. Down a little bit for herbs. mitral. I'm going to start over with the other side.
Okay.
So aortic. Pulmonic. Herbs. And then tricuspid. And mitral. And now I'm going to flip back over, and what I'm going to do this time is I'm actually going to listen to your heart for 1 minute.
Okay.
Okay? And this just lets me have a longer listen and also count your heart rate. So apical heart rate, I counted to be 84 beats a minute, which is perfectly normal. And then also, I heard S1 and S2 sounds whenever I was checking over your heart, which is also normal, and I did not hear any abnormal sounds at all.
Okay.
So now, after listening to your heart, I'm gonna go ahead and move on to the chest area. So I'm gonna do both front and back of the chest, just to let you know. We'll start with the front, I'll let you know whenever I'm gonna move around to the back, okay? Alright, so can you just take a couple of deep breaths for me? Okay, so do you notice any difficulty whenever I'm asking you to take deep breaths like that? Okay, perfectly at ease?
Yeah.
Alright, okay. So I'm also now going to go ahead and listen to the front, okay? And I'm just gonna listen to several areas over the front, okay? And I'm just gonna go on a side-to-side motion for you. Lift up the NUR, thank you. Same on this side, thank you. And final place. Okay, so with that part of the chest assessment, it looks like your skin is intact, even color, even temperature. I don't see any lesions or rashes at all when you were breathing for me. It looked like you had symmetrical rise, that you weren't having any difficulty or labored or uneven breathing, and then your lung sounds were cleared out auscultation, which is all good. So I'm now gonna go ahead, I'm gonna go around to the back side, and I'll tell you what I'm going to do whenever I'm getting ready to do it, so there's no surprises, okay?
Okay.
All right. Oh, thanks, I was gonna have to ask you to strip your hair. So, first thing I'm gonna do is what's called percussion. So what that means is I'm actually gonna be tapping one of my fingers on my left hand with a finger on my right. Just lets me listen to your breath sounds in a different way, okay? Just gonna have you use all over. Any tenderness at all while I'm doing that?
Mm-hmm.
Okay, so with that, what I heard was resonance, which is a sound that I'd like to hear. whenever I'm doing that, just lets me know kind of how the air's moving in a different way than just with my stethoscope.
Okay.
Next, I am actually going to go ahead and listen with my stethoscope. I'm gonna have you take probably about 8 to 10 deep breaths as I move my scope around, okay? So
Okay.
I'll let you know. Alright, so I'm gonna go ahead and have you deep breath in through your nose and out with your mouth for me. And again. Okay, so your breath sounds sound good and equal. Did you have any difficulty with that at all?
No.
No, easy breathing? Okay.
Easy breathing.
Lungs sounded clear throughout, which is good. Now I'm also gonna feel around on your flank, which is the kidney area right in here. What it's gonna let me do is I'm gonna do a kind of percussive technique again. So you might hear a little bit of that, but it just lets me know if you have any type of tenderness or anything like that in the area. So you're gonna feel my palm first. Any tenderness there?
No.
Okay. And again. Any tenderness with that?
No.
Okay. So no tenderness on that. I'm gonna go ahead and come back around now.
Okay.
Okay. So now that we've done that part, I'm gonna go ahead and I'm gonna have you lay down.
Okay.
And I'll give you a sheet here. Are you cold at all?
Little
A little bit cold? Yeah. Alright. Okay, so kind of just tuck you up for right now. Are you comfortable?
Mhm.
Okay, so I'm actually just gonna kind of watch you breathe for just a little bit because when you're laying down, breathing can look a little bit different than when you're sitting up, okay?
Okay.
So just go ahead and breathe normal, don't try and do anything fancy for me. Okay, so I'm not noticing anything that's called lifts or heaves, and I don't obviously see any pulsations, like if your heart were, or arteries were pulsating too strongly, so that's also good and within normal limits. I'm now gonna need to be able to feel around on your heart area some, just to see if I can feel any pulsations differently than whenever I was listening, okay? This one come around to the base. Okay, so right now there's no palpable pulsations with the aortic or pulmonic or mitral valve, but apical pulsation can be felt with palpation. And like I said, there were no lifts or heaves. Next, I want to be able to look at your abdomen if that's okay.
Okay.
So I'm going to lift up your shirt a little bit.
Okay.
Try not to get you too cold here. I know it's kind of chilly in here. So I'm just going to kind of look around to see kind of as you're breathing, things like that. So as I'm looking, I see that her skin color is even. She does have some freckles, which is normal. She does have a belly button piercing, also nothing wrong with that. Otherwise, I don't notice any stretch marks, striae, anything like that. Doesn't look like I see any rippling effect. So right now, just looking at her abdomen, everything appears to be normal. Contours flat, not at all rounded, not distended. And she is on the thin side, so I can see a little bit of her aortic pulsation, which is also perfectly normal. I'm now going to go ahead and listen. I'm going to do separate areas of the abdomen. I apologize in advance if my stethoscope's on the cold side.